Welcome to Module 1. The purpose of this module is to provide participating practitioners and billers an overview of the ATOP2 program and how it benefits both residents of nursing facilities as well as practitioners participating in the program. In 2011, Health Insight Nevada was one of 7 organizations across the nation selected by the Centers for Medicare and Medicaid Services to lead the initiative to reduce avoidable hospitalizations among nursing facility residents. During Phase 1, the ATOP initiative tested models to improve quality of care and reduce avoidable hospitalizations by providing education and clinical intervention to 24 nursing facilities in Nevada. Phase 1 objectives included reduce the frequency of avoidable hospital admissions and readmissions, improve resident health outcomes, improve the process of transitioning between inpatient hospitals and long-term care facilities, reduce overall healthcare spending without restricting access to care or choice of provider. The result was a statistically significant reduction in total expenses as well as spending on all-cause and potentially avoidable hospitalizations. For example, total spending decreased 21.7% per resident on average. All-cause hospitalization spending declined 37.5%, and potentially avoidable hospitalization spending was reduced by 42.5%. In Phase 2, CMS selected 6 enhanced care and coordination providers, including Health Insight Nevada, to continue their partnership with long-term care facilities and practitioners across the country to implement and test a new payment model. In December 2016, Phase 2 was implemented in 13 nursing facilities in Nevada and 21 facilities in Colorado. Phase 2 was executed in a manner consistent with meeting CMS objectives of the initiative's first phase. Phase 2 incorporates new payment levels aimed at making it more financially advantageous for both nursing facilities and practitioners to treat certain conditions in-house rather than admitting the residents to an acute care setting such as a hospital. Specifically, there were modifications to the practitioner fee schedule for an initial visit to treat an acute change in condition for one of the 6 qualifying conditions in a nursing facility: pneumonia, congestive heart failure, COPD asthma, skin infection cellulitis, fluid or electrolyte disorder dehydration, and urinary tract infection. The new payment model is designed to financially support treatment of beneficiaries in their long-term care facility when appropriate to minimize disruption to the patient and hospital-acquired infection, equalize the financial incentives for practitioners that exist between treating beneficiaries in a nursing facility compared to a hospital, about a $70 increase per beneficiary per day, increase practitioner engagement in care planning activities and encourage their participation in patient care conferences by including a practitioner payment for care coordination and caregiver engagement. You have now completed Module 1 of the ATOP2 Billing for Practitioners course program overview. Next up, ATOP2 Clinical Conditions and Billing Criteria. But first, click below to test your knowledge of the ATOP2 program.